waking up all North Texas. Good Day continues on Fox 4.
All right, welcome in everybody. Thanks for being with us on this very busy Sunday morning. I'm Jenny Anchondo. We are following breaking news right now. State Health Department confirming a second case of Ebola in Dallas. That patient is a health worker at Texas Health Presbyterian Hospital who came into contact with the first Ebola patient, Thomas Eric Duncan. You're looking at a live look again from Texas Health Presbyterian Hospital here in Dallas. This is the second case of Ebola diagnosed in Dallas and the first time someone has contracted the virus in the United States. According to the Texas Department of State Health Services, the worker reported a low-grade fever on Friday. We're told that that person was isolated right away. The preliminary test result was received late last night. We got word of it early this morning. The worker provided care for the Ebola patient, Thomas Eric Duncan, who was hospitalized there and died last week. A second test will be done by the Centers for Disease Control and Prevention in Atlanta. Right now, health officials are working to find people who were possibly exposed to this healthcare worker. So again, live pictures as you look right now at Texas Health Presbyterian Dallas. We are awaiting a 7:30 news conference this morning. We are told that that will be happening at any moment. So as soon as that happens, who we'll hear from is the mayor of Dallas. We'll also hear from Dallas County Judge Clay Jenkins. They're going to be giving an update. So a lot of questions here, and we'll take you back to it as soon as it happens. Meantime, a healthcare worker, you know what? We already talked about that. The family of a man who died from the Ebola virus here in Dallas believes that his health was handled inappropriately. They say that it was handled poorly and unfairly. Thomas Eric Duncan died last week after becoming the first person diagnosed in the United States with Ebola. Grieving family members say that they just wonder whether he might have survived if healthcare workers had not sent him home with a 103-degree temperature when he went to the hospital September 25th. He was rolled out on a stretcher after he was released.
Everybody come to America. That's the land of opportunity. So he came here to see his son graduate high school, and we was going to start a business so we can help these kids, you know, get them situated. Now we don't have the opportunity anymore.
Texas Health Presbyterian Hospital says it gave Duncan the best treatment possible, adding that the drug Z-MAP was not available. That's what Americans Ebola patient Nancy Wright-Bull and Dr. Kent Brantley from Fort Worth received. The State Health Department may investigate whether the hospital violated safety laws at all. Duncan's family is also claiming that he was cremated without their permission. The CDC advises that the remains of Ebola patients should be cremated or buried promptly in a sealed coffin. Officials say that the Commissioner of State Health Services Department recommended cremation to Duncan's family and that they agreed. They are saying that they did not agree to that. Well, the ashes of items taken from the East Dallas apartment where Duncan became ill with Ebola will be taken to a Louisiana hazardous waste landfill. We take you now live. Dallas County Judge Clay Jenkins speaking at that news conference.
That healthcare worker is a heroic person who provided care to Mr. Duncan. I met with that healthcare worker's parents, and the healthcare worker and their parents have asked that their privacy be respected and their name not be released at this time. I expect with the activities that happened today, information will come to light, but let's remember as we do our work that this is a real person who is going through a great ordeal, and so is that person's family, and let's be as respectful as we can possibly be. We expected that something that it was possible that a second person could contract the virus. Contingency plans were put into place, and the hospital will discuss the way that the healthcare worker followed those contingency plans, which will make our jobs in monitoring and containment much easier in this case than in the last one. I want to stress before we bring up a doctor a very important fact. You cannot contract Ebola other than from the bodily fluids of a symptomatic Ebola victim. You cannot contract Ebola by walking by people in the street or by being around contacts who are not symptomatic. There is nothing about this case that changes that basic premise of science, and so it's important that while this is obviously bad news, it is not news that should bring about panic. We have a strategy to monitor. I will go over that strategy, and the mayor will go over the strategy to keep the community safe and secure, the dwelling and belongings of this patient. But first, Dr. Varga with Presbyterian will give us pertinent information pursuant to HIPAA and pursuant to the wishes of this family, as much pertinent information as he can share in an effort to get the public the information. Dr. Varga.
Thank you, Judge. Late last Saturday evening, a preliminary blood test on a caregiver at Texas Health Presbyterian Hospital, Dallas, proved positive for Ebola. This healthcare worker had been under the self-monitoring regimen prescribed by the CDC and based on involvement in caring for the patient, Thomas Eric Duncan, during his care that started on September 28th. Now, individuals who are being monitored are required to take their temperatures twice daily, and as a result of that process, the caregiver notified the hospital of imminent arrival and was immediately admitted to the hospital's isolation room. The entire process, from the patient's self-monitoring to the admission into isolation, took less than 90 minutes. The patient's condition is stable. A close contact has also been proactively placed in isolation. The caregiver and the family, as already stated, have requested total privacy, so we can't discuss any further details of the situation. As the judge mentioned, we've known that further cases of Ebola are a possibility among those who were in contact with Mr. Duncan before he passed away last week. The system of monitoring, quarantine, and isolation was established to protect those who cared for Mr. Duncan, as well as the community at large, by identifying any potential Ebola cases as early as possible and getting those individuals into treatment immediately. Finally, we have put the emergency department at Presbyterian on diversion until further notice because of limitations in staffed capacity. That means ambulances are not currently bringing patients to our emergency department. While we are on emergency department diversion, however, we continue to fully care for all of our patients, and we are also using this time to further expand the margin of safety by triple checking our full compliance with the updated CDC guidelines. We are also continuing to monitor all staff who had some relation to Mr. Duncan's care, even if they are not assumed to be at significant risk of infection. All of these steps are being taken so the public and our own employees can have complete confidence in the safety and integrity of our facilities and the care we provide. Thank you.
As an added step, in consultation with the CDC will be working with Presbyterian to monitor all the people that were in the self-monitor pool as we are monitoring the 48 people in the monitor pool. And so the people that are that were self-monitoring, all of whom are healthcare professionals, will now be monitored twice daily by epidemiologists and interviewed today by CDC epidemiologist. We are, because that is an increase in workload for the CDC, DSHS, and Dallas County epidemiology team that currently has 19 epidemiologists and disease detectives on the ground. I requested additional epi team and disease detective resources at midnight last night, and they, I believe, have arrived and are meeting with Dr. Kuhar in another room. The CDC is not here today, as the PC, they are busy working, and we are about to leave to get back to the EOC. The PCR test has not been confirmed by the CDC in their lab as a double test, but we are confident that unfortunately we're confident that it will be. And that's what necessitated the state's release. The state is also not with us this morning, but they are actively working. There's much to do right now, and they are working to keep you safe. So the monitoring will continue. The 48 that we've been monitoring remain asymptomatic and without fever. And we will be working with Health and Human Services, the CDC, and our state partners and Presbyterian today to make sure all necessary protocols are put into place. And here's Mayor Mike Rawlings.
Good morning. We heard about this around midnight and have been working throughout the morning to make sure that citizens of Dallas are safe when they wake up. I believe I can say they are. Let me tell you what we have done, what protective measures we have taken to ensure that safety. The Dallas Fire and Rescue Hazmat team has cleaned up the common areas and decontaminated any of the open areas of an apartment complex in the 3700 block of Marquita. They sprayed a cleanup agent, and right now the police are standing by to make sure no one enters that apartment complex. Furthermore, we have knocked on every door in that block and talked to every single person that came to the door, explained what has happened and what we have done so they will not be afraid of the hazmat unit. The police officers are ensuring that no one will enter that apartment. Later this morning, we will also go back and knock on every door of that neighborhood to make sure there are any questions and we catch everybody. At 7:15, a reverse 911 call was sent out to the 4 blocks around the apartment complex, and we left printed material at each door, so if there are any questions, folks should call 311, and obviously if anyone feels sick or needs paramedics, they should call 911. We also have a report that there may be a pet inside the apartment, and we have a plan in place to take care of the pet, and we do not believe that pet has any signs, and will move accordingly later today. At the same time, we have moved our Dallas Fire and Rescue Hazmat unit over here to Presbyterian Hospital, where we decontaminated the car that the patient drove in and secured it so nobody could come in contact with the car. We decontaminated hand railings, everything in the parking lot, so everybody can feel comfortable that the exterior was taken care of. We have a plan in place to send hazmat units into the apartment and clean up the interior later today. I want to say once again that we had this plan in place last week. So when we got this phone call, which we thought we might get, we put in an action team in place, and they have been working all this evening. So as people are waking up, they know that they are safe. There is much work to be done yet, but we wanted to make sure that you knew instant information from us as soon as you woke up. And as you know, we're going to be staying in constant contact with you, but we're going to let CDC test this specimen and let them make some comments, and then we'll be getting back to you. Until then, Judge Jenkins and I have a lot of work to do, and we'll leave you with a good doctor. Thank you.
We have time for about 2 or 3 questions for Dr. Varga.
Doctor, did this worker, is this healthcare worker someone who works specifically at Presbyterian Hospital? Did this person come into contact with Duncan on the first ER visit or when Duncan was brought ambulatory the second time? And can you talk as specifically as you can about what sort of contact this worker might have had? Was it with blood or vomit?
I can't speak specifically to the type of contact. This is a worker who works at Presbyterian who was involved in the care of the second visit.
The second visit?
Yes.
Was it someone who was considered a part of that high-risk pool?
No.
Was it in the lower risk pool?
Yes.
What have you changed, what have you done to protect other health workers who, you know, during that second visit especially, I think there was some indication early on that there may be an Ebola case here. What have you done to make sure that other workers who were involved in kind of the same way that this worker was are safe? And if you could talk about specific measures you've taken to that point.
So all of our workers are following CDC recommended precautions. And to be any more specific than that would be speculating. But all of our workers are following CDC prescribed precautions when they interact with the Ebola patients.
Can you say if this person was wearing protective gear?
Pardon me?
Can you say if this person was wearing protective gear when they came into contact?
They were.
With Duncan? They were wearing
They were.
protective gear?
Was this a support staff person or a medical provider?
Really in interest of the patient, or excuse me, of the healthcare workers' privacy, I won't go into further detail than we already have on that.
Going further on Manny's question on protective gear, are we gloves, mask, what other protective gear was this person wearing?
This individual was following full CDC precautions, which are barrier and droplet. So gown, glove, mask, and shield.
Okay.
How disturbing it is that even after those precautions, this person is still contracted the disease.
We're very concerned.
How do you assure people if somebody has, it's got to be scary for workers that have followed the CDC guidelines for them to still get infected. How are you assuring people that they can be protected?
We're still confident that the precautions that we have in place will protect our healthcare workers. We don't have a full analysis of all of the care. We're going through that right now to try to understand specific elements of who came in contact with Mr. Duncan, around what circumstances, on what day, et cetera. But we're confident that the precautions we have in place right now are protecting our healthcare workers.
Has this person self-quarantined over the last last week and a half or so, or have they been out and about?
The healthcare worker has been doing self-monitoring and did not work the last 2 days.
What day do you think this person came into contact with the fluids?
Yes, sir.
How many of the contacts from Eric Duncan have been doing self-monitoring, and do you have a number of contacts that you're tracing for this patient?
I can't give you the full details of all of the contacts. Texas Health Resources and Texas Health Presbyterian Dallas are currently tracking 18 employees.
But can you clarify?
Give us a timeline. I mean, when do you learn that this was happening, and what has happened since then until now?
I can't go into specific detail on the timeline because of the protected nature of that. I would reiterate in this particular situation, however, from the time that the self-monitoring indicated the need for contact to the time that the patient entered full isolation in the emergency department was less than 90 minutes.
But to
Okay,
clarify, this
we need
person
to let
was
Dr.
not
Varga.
one of the 48?
Sorry, Dr. Varga needs to
But it's
leave.
confusing because you said low risk. Low risk means one of the 48.
Yes.
This person was or was not one of the 48?
I can't speak to whether or not the patient falls into what the judge mentioned of the 48. Texas Health Resources has been monitoring 18 patients.
What day do you think this person
have
got
any
infected?
sections of the hospital been quarantined or closed off because of this?
No, but to be clear, you'll recall from Mr. Duncan's care, the area that we have been using for inpatient care is I believe, a 24-bed ICU that we have cordoned off and are isolating specifically to use as our isolation unit for inpatient care for Ebola patients.
Dr. Varga, what's your role in this? Could you just explain?
I'm the Chief Clinical Officer for Texas Health Resources.
Is the patient being given any kind of treatment for the virus?
I can't comment on the care right now.
We'll be posting updates on our website and sending them out through email. But right now, I have to take Dr. Varga to another meeting.
Sir,
Thank you very
the
much.
The hospital is monitoring, they return to work. That's correct? So this was one who has returned to work?
No.
This is not, she's not.
So is the hospital seeing new patients?
All right, everybody, you have been watching this live news conference as we have been learning about the first patient in the United States to be diagnosed after contracting the Ebola virus here. So the takeaway points from this is that this person has been put into isolation. Texas Health Presbyterian in Dallas has an emergency department that they now say is on what they call diversion. That means that patients are not being taken there. That's because of staffing. They say that they will still be taking care of all patients that are already there in their emergency room. Also, we're told that the 3700 block of Marquita, that is in East Dallas, has been notified. So a 4-block area. People have been given a reverse 911 call. We're told that authorities have also taken some materials there to those homes to let people know what's going on in that area. We're told that there are officers right outside of this person's apartment in the 3700 block of Marquita that are making sure that nobody goes inside of that apartment. We want you to stay up to date on all of this. Stay with Fox 4 News for updates on the second case of Ebola here in North Texas. We will alert you once we find out if indeed this preliminary case is confirmed by the CDC. Again, this is a preliminary test. They're waiting for that confirmation from the CDC. You can get updates as well on our website, myfoxdfw.com. We'll be right back.